Medicare is a benefit that is given to older adults, those that are 65 years or older. Sometimes it's given to those that are disabled. Sometimes it's given to those that have end stage renal disease or have ALS or Lou Gehrig's disease. And Medicare includes several parts, and these parts designate the types of coverage that are chosen by the subscriber. It's important to understand Medicare and how it applies to dental, obviously, because a lot of patients have Medicare. So, Medicare Part A is hospital insurance, and it's sometimes referred to as part of the original Medicare, along with Medicare Part B. Medicare Part B is medical insurance, and again, it's part of the original Medicare. Medicare Part C is sometimes called Medicare Advantage, and this insures dental, vision, and hearing. So, Medicare Advantage, what happens is the subscriber will purchase Medicare Advantage and it will replace their standard Medicare Part A and Part B, but it will also give them dental, vision, and hearing. So if a patient has Medicare Advantage, there's a high probability that they're going to have a dental insurance. Now, the dental insurance can be provided through various insurance companies. It can be through, Delta. It could be through United Healthcare. It could be through Cigna. So you have to understand that just because it's Medicare, it's not going to be one single insurance company. Medicare Part D is a supplement to the original Medicare that provides prescription drug coverage. Sometimes people will purchase the Medicare Part D as a supplement. Sometimes they'll purchase Medicare Advantage that will include a Part D coverage. Medicare Plan F through G are supplemental plans that are sometimes referred to as Medigap. They essentially cover the copays or a portion of the coinsurance that's not covered by Part A or B. So when someone comes in and they give you a Medicare card, it might it might show that it only has Part A and B and you can't find any dental coverage. Those patients most likely just have the original Medicare Part A and B, and that does not include a dental benefit. It's only their hospital and medical plan only. When patients purchase Medicare Advantage, they might choose underneath there to get a PPO plan. And patients who have selected Medicare Advantage with a PPO dental coverage, they will have an insurance that's very similar to an employer driven PPO coverage. Sometimes it's a little bit even better than an employer driven PPO coverage because sometimes they're covered at 100% on a lot of the procedures. Okay. Medicare Advantage EPO plans are similar to PPO plans, but they can only be seen by certain dentists, so there's a little bit more restrictions, and sometimes the payouts are a little bit different. So we are in network for um, the PPO plans. A lot of the EPO plans we aren't as much in network, so we will offer those patients the open and affordable discount plan, essentially like anyone else who comes in and doesn't have coverage. With Medicare Advantage HMO or DMO plans, we are not in network for some of those, although it's very 50-50 on if we are in network and if we aren't in network. So what we do is we tell the patient we're going to offer to do a complimentary benefits check using the following scripting. So it's important that you know this scripting and are able to kind of recite it. So Medicare plans can be tricky to determine whether we're in network or not in network with them. So I'd like to offer you a complimentary benefits check prior to your visit to ensure that our providers are in network for your particular plan. And if we find that you're out of network for your plan, we'll definitely have options for you, including a cost-effective in-office discount plan that will help you greatly reduce your out-of-pocket costs. So what you'll do is you'll gather all their information needed to verify their plan, including their ID numbers, group numbers, carrier names, and the customer service telephone number from the back of their benefit card. We'll contact the insurance carrier and see if we're in network with their plan. So again, it's important to understand Medicare plans, Part A, Part B, Medicare Advantage Part C, Medicare Part D, plans F through G, and then the types of insurance offered under Medicare Advantage, which would be the PPO plans, which we're going to be in network with, the EPO plans that we're not going to be in network with, and then the Medicare Advantage HMO or DMO plans, which we're going to be in network with some of them and some of them we're not. So again, kind of confusing, especially when you think about the HMO and DMO offered by employers, is going to be different than if we are coming in with Medicare Advantage. We might be in network with them.